All right, in other news, today is National Doctors Day, created by President George H.W. Bush in 1990 to recognize the contributions of physicians to individuals and to communities.
Well, tonight we are joined by Dr. Camelia Lawrence of Hartford Healthcare to talk about National Doctors Day. Dr. Lawrence, welcome. We appreciate your time. And let me ask you this. When people hear that March 30th is a day set aside to celebrate and recognize physicians, what do you want them to think or think about?
I want them to think about the commitments of the physicians throughout our country who've dedicated their lives to the health and wellness of our communities.
Yeah, Doctor, we've talked a lot over the past 3 years about how difficult and taxing the pandemic was on nurses, but we don't talk as much about doctors. How hard was the pandemic on doctors in general, and do you think that you're all starting to recover from it?
The pandemic was absolutely a big struggle for physicians. The doctors, like other healthcare professionals, but in particular, we're on the front lines. And it has definitely impacted the physicians in terms of mental health. Many of us, fortunately, were in supportive environments where we had the support needed, but it was still a very rough time. I think we're bouncing back. We are physicians, we are a group of very resilient people, and I think we're optimistic and looking forward to a brighter future ahead. We still, however, do need the support. We are human beings like everyone else, and a supportive and nurturing environment helps us to do our jobs even much better.
You know, they say necessity is the mother of invention, and the pandemic forced a number of innovations in healthcare, including a new emphasis on telemedicine. How do you think that's going, and is it a good thing for patients moving forward?
Absolutely. I think telemedicine for some specialty have definitely increased access, which has decreased barriers to care. So I definitely think that was one of the good things that came out of the pandemic is telemedicine. And many physicians now, some of their practices are 100% telemedicine. And if the patient does need to go in, there is a communication and partnership with institutions and practices where you can go in to be seen. But what a great way of improving access to care. You can get care from the comfort of your home.
All right, Dr. Camelia Lawrence of Hartford Healthcare, we appreciate you joining us today.
Thank you.
Thank you for having me.